So is your mind slipping? Really, there's lots of people who do have concerns about their memory, being able to recall certain details. I can't quite remember that like I used to. I'm going through a conversation with somebody and I'm missing important details about my past, about what just happened maybe 5 minutes ago or 5 seconds ago. Some people legitimately have concerns about dementia, about Alzheimer's. It's important to have a discussion here because, yes, the obvious things can affect dementia, can affect your ability to recall and have proper memory recall. Obviously, smoking and alcohol, toxic substances, things like that can affect memory. Multiple studies. If you're a smoker, this is just passionately. I speak of this and compassionately to patients. But when we do tests on smokers, we will find out that they almost always will have high carbon monoxide levels in their body, which can affect the mind. Alcohol as well will destroy brain cells and can most certainly affect your cognitive function. And of course, toxic substances. But those are kind of the easy ones. The difficult ones are the things that you and I take for granted and happen day in, day out. You don't know what you got till it's gone. And sometimes we need to address those things and address them directly. There's a lot of people that have low oxygen status. We're going to talk about oxygen hormones, blood sugar status, even other sensory functions such as hearing and all that's effect on the body. Oxygen status. If you have low oxygen status because you're a smoker or because you have low respiratory function, maybe you're not conditioned properly, it's tougher for you to go up and down the stairs, you're just huffing and puffing because of that, or perhaps because at night you are not getting proper oxygen levels because you're not breathing effectively at night. You may have some type of apnea where you have obstruction, or perhaps your brain is not communicating with your respiratory centers and your oxygen levels are lower. Well, that can most certainly, studies, and it's on our website, on our Facebook page right now, you can look that up. Neat article showing that those with lower oxygen status, it increases your risk of dementias, including Alzheimer's. And on that particular study, it shows also that hyperbaric oxygen therapy can be a benefit for those people that do have low oxygen status and helping them with Alzheimer's. So you should check that out. But your oxygen status is important. That's why if you do have sleep-related issues, and getting good night's sleep is important, you should have your oxygen status checked and see if that is a problem. We do sleep studies here as well. There's also some O2 rings you can get. Great information on that. Should have your oxygen levels looked at. We know when it comes to Alzheimer's, who are the ones that get Alzheimer's the most? You know what? It's women. Men get it too. Most certainly they do. But most certainly when estrogen levels plummet, when they plummet, it increases the risk of Alzheimer's. Doesn't that make sense? All dementias, there's an increased risk with age because something is occurring as you age when you go past childbearing years, and when you even men as well, when they're past the 40 and 50 years there as well, some of their hormones drop down. That affects your mind. That's why it's important to address hormones. You should have a normal amount of hormone based off your age. It shouldn't be too high, shouldn't be too low. We know that just giving some people estrogen and just cranking up their hormones is not good for other parts of the body. But most certainly, from when it comes to dementia, we need to make sure that hormone levels are normal. Another hormone that's important to look at, yes, of course, the thyroid. That's kind of an easy one. You do need to make sure that thyroid function is proper and working correctly, converting properly and all that too. Some people are taking thyroid medication, they're not controlled either correctly, so it's good to look at that. But another hormone is insulin. That type 3 diabetes, have you heard that one before? I remember posting that on our Facebook page probably 6-8 years ago. Type 3 diabetes. And that's a term that's being used to describe Alzheimer's, because they know that Alzheimer's is not just about neurofibrillary tangles and those kind of things. It's also about insulin status, because they're showing that there's an insulin type of resistance that's going on in the brain. You're not listening to insulin. It's a blood sugar and insulin connection there with Alzheimer's. So making sure that blood sugar is where it should be. If you've been told, hey, you know what, I'm pre-diabetic, I'm not diabetic, I'm not diabetic, and maybe even your provider isn't even telling you that you're in pre-diabetic ranges, which is really sad because that's important. Making sure your blood sugar levels are normal, that's important for your brain, for your brain, for your muscles and your joints that are perhaps inflamed. You got joint pain. Well, I just have arthritis. Bull. That is ridiculous. Just saying, hey, I have arthritis and just casting that off like I'm just old. That's ridiculous. You need to make sure you're addressing your insulin status. Another interesting one is your nutrient status. That's a very easy one to look at too. We got lots of patients just here in the last week have come in. They've got low B12 status. They have low vitamin D status. They have low omega-3 status. Their iron is low. Even their potassium is low. All those things can affect how your brain functions. Your iron can affect anemia. Your vitamin D can affect all kinds of different things, including increase the risk of types of dementia. Your potassium levels, that's important for sake of blood pressure in your heart and is correlated with some of those things too. Your omega-3s, which is part of your brain, good oils for your brain. And B12 status, 100%. Those are all easy ones to find. And you can have an IV nutrition. Jess, our nurse practitioner here, she does a fabulous job, and she can set you up with those things. Just doing an IV, getting in the electrolytes, getting in the minerals, getting in some of the B12 and some of those things like you need to have, that can help with memory and cognitive function. But some people truly have dementia, and they truly have deficiencies, and they're not being addressed. 100% the case. And if it's a B12 related dementia, that can be reversed. There's also some interesting studies talking about hearing, and that when you have hearing issues, that Alzheimer's, that hearing is related to at least 10% of Alzheimer's and probably other dementias as well. That is a part of is a major sensory organ, you being able to hear. And when you can't hear, well, it's kind of depressing. The rest of your brain has to work harder too. So doing hearing tests, and guess what? We're doing hearing tests here now, and we also are offering hearing aids as well. So over-the-counter types of hearing aids, great hearing aids that are super tiny. You can't even see them. We have more to tell you about that here later on another day. But still, hearing is an important thing, and having your hearing assessed, that's important. So many people, they don't even have an understanding of what their hearing status is. Well, we can test that for you here. Hearing, so it's important even for Alzheimer's purposes. Genetics. Yep, you're right. Some people have a genetic predisposition towards Alzheimer's as well as towards different types of dementias. The ApoE gene, the genetic test, you can certainly do that. That shows some genetic connection. Some people have a methylation problem where they're not methylating properly, and you can test that, and you can also help with that. If you're lacking methylation, you can take it, and you can see if you need it, and that's what we test it. Not to test it to guess, test is to know. So what can you do about all these things, just in general? Well, you should be eating a good diet, really watching your blood sugar and insulin status. When I say blood sugar and insulin, it's also about lifestyle, right? So exercise, 100% studies just on exercise showing that it prevents dementia and prevents Alzheimer's too. Just exercise, doing nothing else, and just coming up with an exercise plan reduces your risk of dementias and Alzheimer's. You bet. Great thing to do. Smoking and drinking alcohol. It's a toxic substance. Nobody's deficient in smoking or alcohol. It's not good for our bodies. We all know that. Some people, you got to live life on your own terms, but still, we know that's toxic and can hurt the brain. So staying away from the easy stuff there. Trying to get a good night's sleep. Well, that sometimes means that you're not going to eat after 7 o'clock at night. If you're eating after 7 o'clock at night, that can affect your sleep. If you're drinking plenty of water after 7 o'clock, that's going to affect your sleep. If you're doing a lot of electric devices and things towards evening hours, that can kind of keep you up. That's not good for sleep. So trying to focus on your sleep, and also if you're not breathing at night because you have low oxygen, you need to address that too. But other things you can do just kind of to support your body, making sure that a good IV of some of those B vitamins, some of those nutrients, all good things there to do as well. We do the hearing tests. If you have hormone-related disorders, we need to look into that. We are offering a free consultation to patients to address these issues, to at least bring them up and say, okay, what seems like the right approach for you? Do you have a blood sugar problem? Do you have a hormone problem? Do you have an oxygen problem? Do you have a hearing problem? Do you have a nutrient deficiency problem? Myself, Jess, our nurse practitioner, our entire staff, we are here to help you get you to a state of optimal health. Your health is different than your neighbor's health, than your spouse's health, than your sibling's health, and we do individualized care, getting to the root causes of problems. So take advantage of our free consultation where we can sit down and at least chat with these issues for you so we can help get you into a better state of health so you can obtain and maintain optimal health. Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed rest of your day.